In this video, we're going to discuss about a common procedure that we do is refractive lens exchange. This mainly pertains to patients who are more than 50, who usually wear glasses, either who are short-sighted or they are hyperopes or nearsighted, what we call, or astigmatism. And people are tired of wearing contact lenses because the eyes go dry as you get older. You are unable to wear lenses as you could do when you're in your 20s and 30s. It's a very common problem that most of my patients do encounter. It's like undergoing a cataract surgery, but it's a clear lens exchange where we replace your natural lens with an artificial implant, which is to try and reduce your dependency on glasses. We use premium implants, what we call trifocal, extra depth of focus, or toric implants, which will help in reducing your dependency on glasses. I'll go through in detail with a few lens options that we have. Number one is a trifocal implant, which is basically what it says on the tin. It's trifocal, so you've got far distance, intermediate, and near. So you've got all three range of vision with these lenses. They work extremely well. Then they are suitable for some kind of patients. There is some trade-off for these lenses where some people may notice a bit of glare or halos while driving at night, but most of the patients who've had the surgery, they say they notice it, but doesn't really stop them from driving. Option number two is what we call extra depth of focus lens. Now, as you get older, your natural lens cannot accommodate what we call, which means it cannot change shape, which is why you start wearing glasses as they get older. So these lenses are a special new technology wherein you get an extra depth of focus with your lenses, which means you get a bit of far distance and a bit of intermediate as well. The advantage in these lenses is you don't notice any glare or halos while driving at night. And what we do with these lenses, we combine with a bit of micro monovision, what we call, which basically means your one eye is aimed for far distance and the other eye is slightly offset to try and get a bit of intermediate and reading. We always say that you get a bit of functional near vision, where I always advise my patients that you may still have to wear a weak pair of reading glasses if you're reading very small prints or if you're reading in very low light conditions. But most of the patients would be happy to move around for the day-to-day life without having to worry about looking for glasses or contact lenses. Third option is for a toric implant, which is mainly for patients who got astigmatism. Now, astigmatism means your eye is more like a rugby ball rather than a football, which is basically an aberration in your eyes, where if you don't correct it or reduce it, you may land up needing glasses, which a lot of patients do. The advantage of toric lenses is just combined with these trifocal lenses or the extra depth of focus lenses to try and get the best possible outcome, so we can reduce your astigmatism at the same time of the operation to try and reduce your dependency on glasses. When you come on the day of surgery, you'll be greeted by the lovely nursing staff who will go through all the details with you and make sure we got everything set up for your surgery. They'll go out for the pre-assessment that you'll have. So good thing about this surgery is there's no needles involved and there's no pain during surgery. And we do only one eye at a time. So when you come for the surgery, the anesthetic nurse will put some anesthetic eye drops in your eyes to numb the surface of the eye. You're lying on your back for the operation. The operation usually takes around 10 to 15 minutes. What you feel is only some pressure, or you may feel some water, but there's no pain. You'll hear some buzzing noise from the machine, which is where the lens has been taken off. And you may feel a bit of pressure sometimes when the new lens goes in, and you may see a shadow when the lens goes into the eye. You'll have a patch on your eyes for 4 to 6 hours after the operation, but we advise the patients not to drive on the day of the operation. You go back home on the same day and you need to put some antibiotic and steroid eye drops for 4 weeks to try and help with the healing process. Most of the patients would not have any symptoms. Some patients may report having a bit of foreign body sensation or a bit of dry eyes after the operation, which is only transient and lasts for a few days to a few weeks. It all heals up slowly. And we do one eye at a time, and the second eye can be done 2 to 4 weeks later, depending on your preference. But we advise minimum wait period of 2 weeks between 2 eyes. When you come back for the post-op consultation, we check your eyes and we make sure we achieve the desired outcome before we plan the second eye surgery. And we tailor the second eye surgery depending on the outcome from the first eye. And if in case we've decided for micro monovision, what we discussed earlier, where we can tailor the needs accordingly to try and get the best option to reduce your dependency on glasses. Now, we say this and we achieve this in more than 95% of our patients. We always tell that there's a less than 5% risk that you may still land up needing glasses for distance reading or both, although the risk of that happening is extremely low, but this is depending on your healing process, which means you may have to have more enhancements to try and fine-tune the outcomes. But I said this happens in less than 5% of our patients, and most of the patients are quite happy with the results.